Welcome, everyone. Very excited to have all of you join this informational webinar about the Commonwealth Fund Fellowship in Minority Health Policy at Harvard. If you go to the next slide, please. I just want to do some general housekeeping. The slides and a recording of this webinar will be available after the webinar. All lines are muted, so please submit your questions through the webinar in the Q&A box, which is usually located at the bottom of your screen. So if you go to the next slide. I'd like to introduce myself. I'm Lori Zephyrin, and I'm Vice President of Health Systems Equity at the Commonwealth Fund. And I think we have an exciting agenda today where I'll provide an overview of just the Commonwealth Fund, and you'll hear about the fellowship program and hear from alumni and their experiences. Then we'll open it up to Q&A where you'll be able to type in your questions and we can respond to them. So we'll start with the next slide. So I'm Lori Zephyrin, as I mentioned, and I'm at the Commonwealth Fund, and we're very excited and honored to support this fellowship, which has been in existence for over 2 decades. We are at the Commonwealth Fund an independent, nonpartisan think tank and foundation, and our mission is to achieve a high-performing health system that provides affordable, quality care with a special focus on really improving healthcare for those most vulnerable to inequity. If you go to the next slide, there are 4 key areas that we support research in at the Commonwealth Fund. One around achieving universal coverage, advancing health equity, improving how care is delivered, and controlling healthcare costs. Next slide. I want to talk a little bit about our Advancing Health Equity program. We go to our next slide. And so our Advancing Health Equity program, we all are aware, and I think more people are even more aware now of our nation's legacy of racism and how that's embedded into the healthcare system and how that impacts the healthcare and experiences and outcome that people of color experience. And so essentially having worse outcome to high quality care and worse access and poorer outcomes. And so part of our goal at the Commonwealth Fund is to research policies and practices that are needed to promote and achieve an anti-racist healthcare system that really allows all of us to thrive. If you go to the next slide, we have 3 focus areas within our Advancing Health Equity program. Our ultimate goal is to eliminate unequal treatment, unequal experience, and unequal outcomes in health and healthcare by reducing, dismantling systemic racism in healthcare policy and practice. And our 3 areas of focus are around how do we promote dismantling racism in healthcare delivery systems? How do we help promote policies that bring about equitable access? We know the role of health policies in entrenching structural racism, and so really helping to promote policies that dismantle systemic racism and bring about equitable access. And then ultimately also thinking through how to change culture, beliefs, and attitudes around racism and really promoting equitable care. The fellowship program, if we go to the next slide, has been a really key aspect of the Commonwealth Fund and of this program. It's really critical as we think about advancing diverse leadership in care delivery, but also building a cohort of healthcare leaders and supporting a cohort of healthcare leaders that are well-versed in health equity, committed to health equity, and really leading efforts to promote health equity and dismantle structural racism. And so you'll hear from the fellows who have gone through this program, just their extensive leadership experience and the work that they've been doing throughout their career to really improve our healthcare system and advance health equity. If you go to the next slide, I just wanted to share just some of the work that we do at the Commonwealth Fund and how that really links to this program as well and the importance of this program. We know that addressing racial discrimination in the US healthcare system is really important. We're seeing an increase in the number of people who report racism as a very big problem in the country today. From how people of color, particularly Black and Latino people, experiencing overt discrimination in a clinic, or not being offered the best available treatment, or being denied timely access, or not referred to specialists. And we just all know just the impact of that on outcomes, whether we're talking about maternal health or cancer care, or just overall access to primary health care. If you go to the next slide, I mean, as we think about the pandemic today, we also, polled a number of respondents. And when we think about people getting vaccinated, this sort of looks at the percentage of respondents who agree that people in their race and ethnic group face discrimination, and how that impacts their willingness or ability to get a vaccine. And so really addressing racism, addressing structural racism is really important in ensuring that our healthcare system is responsive to the needs of Black and Brown people. If you go to the next slide, if you go to our website at the Commonwealth Fund, this is just some examples of some work that we've been publishing as well. And so please, go to our website if you have interest in terms of our work around advancing health equity. And next slide is just our advancing health equity team that I'm very excited to work with as well. You can learn more, next slide, about our programs and our work at the Commonwealth Fund, or feel free to reach out to me via Twitter or LinkedIn or email as well. So let's go to the next slide. And I'm very excited to turn this over to Dr. Joan Reed, who has been, who designed, developed, and has led this program since its inception. Dr. Reed is just someone I consider as a mentor and advisor, and she's Dean of Diversity and Inclusion and Community Partnerships at Harvard, Professor of Medicine, and Director of this Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. So I'll turn it over to Dr. Reed.
So thank you very much. Next slide, please. So I want to thank you, Dr. Zephyrin, for that introduction and for the background about the Commonwealth Fund. To tell you more about this fellowship program and its goals, it has three main goals. One is around preparing physicians to become leaders who will focus on improving the health of disadvantaged and vulnerable populations through transforming healthcare delivery systems and promoting innovation in policies, practices, programs that address issues of health equity and social determinants of health. The second is increasing the representation of well-trained, creative, minority individuals from minority populations who are leaders in health. And the third is looking at the continued career development and advancement of those alumni fellows, of those leaders, as they move into positions to create real change. A little bit about what's happened with this program is the next slide. The Commonwealth Fund Fellowship began in 1996, and if we look over this time period from 1996 to 2021, you see that 100% of the alums have remained engaged in issues around policy, research, service delivery related to minority and disadvantaged populations. The vast majority are on advisory committees or boards or assignments that relate to these areas. Many of them won awards. Two just this week were elected as members of the National Academy of Medicine. The vast majority, close to 80%, hold academic appointments in medical schools or schools of public health, and they cross multiple sectors, from the academic sector to public and private sectors. So having an impact in many places. Next slide, please. So what does this fellowship offer, and how do you get into the fellowship? And if you think about eligibility, the Commonwealth Fellowship, this one is for physicians who've completed residencies, so they must be board certified or board eligible, US citizens or permanent residents. And we're looking for individuals who have evidence of leadership experience and potential, and a deep and sustained commitment to vulnerable populations. This fellowship includes a $60,000 stipend. It's a one-year fellowship with full tuition to the School of Public Health at Harvard or the School of Government. includes health insurance, books, travel, program expenses. But I think one of the most important parts of this fellowship is the network of other fellows as you move on and become alums of the program. And you'll hear more from this later as some of the Commonwealth Fellows will actually speak to you. Next slide, please. It includes an MPH, as I said, at the Harvard Chan School of Public Health, or the Harvard Kennedy School of Government, from the School of Public Health, an MPH, and from the Kennedy School of Government, an MPA. For the School of Public Health, there are two fields of study: healthcare management, health management, or health policy. But in both, there are classes available across the entire Harvard system, so there is cross-registration. Last year, the program was virtual. This year, it's hybrid, mostly in person, but also virtual. And can't tell you what we'll be doing next year as we look at how the pandemic has continued to roll out. Our hopes is that it will be fully in person, but depending on what happens, part of it may also be virtual. The course requirements really are based on whether or not someone is going from the MPH or the MPA. So fellows have to meet the basic course requirements for that degree and the course requirements for the field of study. And then there are specific courses that are required by the fellowship program that also meet the requirements for a degree. Courses such as the Leadership and Minority Health Policy course that's led by Alden Landry, who you'll hear from later. Next slide, please. There are many accompanying activities from leadership forums, skill development series, seminars, journal clubs, special training such as op-ed writing workshops. There's practicums that fellows do. All students at the School of Public Health are required to do a practicum. The fellows practicum for this program are a little bit more involved. There's mentoring on multiple levels, from alumni fellows to faculty to a series of individuals crossing different disciplines and different settings that serve as mentors for fellows. And there's multiple meetings, group meetings, individual meetings. Fellows attend national conferences such as Academy Health. And there's a special program that has been around for 3 years. It's sort of this combination of biopsy of the system and nuts and bolts, where there's an opportunity to get real world experience with executive leaders within the Harvard Medical School affiliated hospitals, to shadow leaders within this system. Also shadowing opportunities for individuals outside of the Harvard system. Site visits that are both national and local, and hopefully they will return to being in person. And then there's an annual meeting where fellows make presentations from their practicum projects, but also have an opportunity to meet alumni fellow. Next slide. So when I think about these activities, part of the work of the fellowship is building one's own personal narrative, their own personal journey to the fellowship, their own self-reflection about who they are, what their values are, and where they want to take their careers. It's expanding the career networks within their discipline, expanding those networks across sectors, expanding their networks with individuals who are deeply involved in DEI, diversity, equity, inclusion, anti-racism, elimination of health disparities. It's around systems understanding that this work is done at multiple levels, from local to state to national, at multiple levels, from a department to an institution to a health system, crossing multiple spaces, from public-private sector, from foundation sector, from research enterprise, connecting leadership and policy programs. And so connecting to other programs within the Commonwealth Fund with other foundation-funded leadership programs and expanding the network there. And a critical component are the alumni connections and the family of individuals with shared values, shared interests in eliminating disparities. Fellows become connected to their own cohort, but also others, and you'll hear more about that from Dr. Fleming. Next slide, please. So the deadline for application, important, is December 1st of this year. And you see listed the address for getting an application and how to apply. Applications are required for both the Commonwealth Fund Fellowship, and if you're going to applying for the Kennedy School for the Master of Public Administration application for the Kennedy School of Government, and for the Harvard Chan, the MPH application. So you're applying or filling out two applications, one for the fellowship and one for the graduate program. If you have any questions about this, you can contact our office, 617-432-2922, or email this mfdp_cff@hms.harvard.edu. And next slide. And a little bit about the alums. You're going to hear from some of the alums today, but here's some examples of many positions, from academic positions in our health systems, such as the role that Joe Betancourt has now, who established the Disparity Solutions Center. Alice Chen, and you see here her listed role with government with the state of California, who now is the Chief Medical Officer with Covered California. Michaela with the feds and federal government in terms of PCORI. You see individuals such as Jackie, who's with in the private sector with Humana. Wall, who is a department chair in OBGYN at Harvard. You're going to be hearing from Ross, and so he'll tell you more about himself. Don, who has done so much work in Native Health and just received the APHA Helen Rodriguez Tria Social Justice Award. And LaQuandra, who is director in the DC Department of Health. So multiple sectors, multiple roles that alumni hold. Next slide. And then current fellows, and you're going to be hearing from one of those current fellows today, Kevin Simon. The Commonwealth Fellows are joined by the Joe Henry Fellows, who are dentists, oral health fellows, and our oral health fellow for this year is Wayne Stevens. But you see they are individuals from multiple disciplines, OBGYN, internal medicine, surgery, pediatrics, really crossing the board, psychiatry, and from multiple institutions. So there's diversity within that also. Next slide. And now we're going to turn to Kevin Simon, who is a current HMS fellow. With that, I'm going to turn it over to Kevin.
Thank you, Dr. Reed. Can the slide up? So just wanted to let you all know about myself. So I'm first a husband, a dad, and in terms of trajectory towards the fellowship, went to undergrad at Morgan State University, that's in Baltimore, Maryland, HBCU. Then went on to Southern Illinois, so moved to the Midwest, did adult residency at Morehouse School of Medicine in Atlanta, particularly affiliated with Grady. And that was in general psychiatry. Then opted to do some additional clinical fellowships, particularly in child and adolescent psychiatry, as well as pediatric addiction medicine. Both of those are at Boston Children's. And throughout, I guess, the lifeline of medical school throughout, I have friends and mentors themselves who have done the fellowship and particularly highlighted the network. And so probably 3 or 4 years ago, I started to get in touch with Dr. Landry and thinking about next steps, where I'd like to be. I kind of knew that the Commonwealth would be something I aspired to apply to. And so far, it's only October, and so formally been in the program since July. And in 3 months, the network that Dr. Reed just talked about, you have full ready access to it. There are courses where we really do see and engage with leaders in healthcare, from the VA to private sector, commissioners of health, both locally as well as in other states. And so to have that kind of intimate connection with people and who are themselves leaders, but at the same time trying to help you become a leader and help you craft what your vision is, it's an invaluable experience. And so it really is pretty cool to see. I think one of the fellows, or maybe it might be two, are on the Biden-Harris COVID-19 Health Equity Task Force. So really, you can just span the industry, and you're going to probably find someone that's a Commonwealth Fellow if they're BIPOC. So to me, so far, I have no regrets. And in terms of the hybrid nature, there's an admin, a part of the fellowship that makes sure we know exactly where to be at all times. So you should not have any particular worries about not being able to be somewhere on time. So that's what I have. You know, I think we're going to have questions and answers at the end, and I'll happy to answer any questions that arise.
So, thank you very much, Kevin. And now we're going to turn to Mary, who is Mary Fleming, class of 2011, locum tenens physician in obstetrics and gynecology, but also president of the Reed Scholars. Mary?
Thank you, Dr. Reed, and good afternoon, everyone. Thank you so much for joining us. I am super excited to share my experience with the fellowship with you. So I came to the fellowship after completing my OBGYN residency at Meharry Medical College in Nashville. And I really enjoyed being a clinician, and I'm still a clinician. I'm on call today, so I apologize in advance if you hear any overhead paging in the background. But I knew I really wanted to have some additional training and learn how I could affect change on a much larger level for the vulnerable populations that I had been seeing during residency. And so when I was looking for something that would give me that training, I came across the Commonwealth Fund Fellowship in Minority Health Policy and saw a familiar face on the website, which is Alden. You're going to hear his name a lot probably during the course of this conversation. And he also happens to be a friend of a friend from Nashville. So I gave him a call. And after that call, I was like, this is the place for me. And so I started working on the application. And Alden, as well as all of the other fellows that I came in contact with over that year, all said this was going to be the best year of my life. And of course, that's a tall order to fill, but they were indeed correct. So these pictures that you're seeing on the screen are my cohort. And it was just an amazing experience to be around people who were like-minded, but also focused on trying to improve outcomes for vulnerable populations from whatever community that they were serving. And so we spent a lot of time in the fellowship with each other. We spent a lot of time in class together, a lot of time studying together, doing small groups and dinner sessions. But we liked each other so much, we also spent a lot of time outside of the classroom together as well. And we still are spending time together. Even now, we attended each other's weddings, we talk, as needed, and catch up and have lunch and brunch when we're all in the same city or same town. You can go to the next one for me. And so these relationships, as you've heard, are not unique to our cohort. All of the fellows really bond with their individual cohort and with each other. And as Kevin said, it's very easy to pick up the phone, send an email or a text to any of us in the network at any time, and we will do whatever we can to help each other, either personally or professionally. And so we liked each other so much that we bonded together to form the Reed Scholars, which is the alumni arm of the fellowship. We are a 501c3 nonprofit organization. And we, as individuals, we really appreciate the training that the fellowship gave us, but also the mentorship of Dr. Reed. And I think she really trains us to be leaders, but she also built us up as individuals. And that's something that's invaluable and we often don't get in our everyday lives. As Reed Scholars as an organization, of course, we're a small group, but we have grown and are continuing to grow and expand our intellectual capital around health equity. So our two major signature events each year are the Health Equity Symposium, which is held in May in conjunction with the annual meeting. And then next year in 2022 will be our 5th annual leadership retreat, which allows us again to develop individually as leaders, but also develop the strategies and progression of the organization itself. At the end of 2019, one of the ways we wanted to continue the health equity conversation outside of the academic space was by launching a podcast. So we have a weekly series called Read Scholars Live. Most of the guests are Read Scholars, but there's some non-Read Scholars as well. And we talk about health equity issues across the gamut and really try to help have a broad-based conversation that is very relatable for both professionals in the space, but also people who are interested in the space coming from an educational point standpoint, our students, but lay people as well. So we're really excited about that. And definitely, if you're interested, you can check us out on YouTube or on any of the podcasting platforms. So with that, thank you again so much for tuning in today for this webinar, and we look forward to questions.
So thank you, Mary. Our next alumni speaker is Ross Jones, Commonwealth Fund class of 2015, clinical assistant professor, University of Florida, medical director of community health, medical director of total care clinic group, University of Florida Health, Jacksonville, Florida. Ross?
Good afternoon, and thank you for having me. So what brought me to the fellowship was I had always had a strong interest in health policy. However, where my medical school is a more traditional medical school that really didn't focus on policy, so I was always looking for an opportunity to strengthen those skills. So when this flyer for the Commonwealth Fellow, I still remember it was in the Office of Minority Affairs at med school, and it said that you had to complete residency. So I was bummed for that, but it's something that always stayed in the back of my mind. I finished my residency in family medicine at a community hospital. I worked for 2 years, but I still had that itch to really dive into health policy. So that's what made me apply for the fellowship. Once I got into the fellowship, everyone, like Mary was saying, everyone was saying that it's the best year of your life, and that's a tall order. And it really, truly was one of the best years of my life. Just from the academics, and then you also develop this close, intimate bond with all of your co-fellows. These are people who, you kind of start out as strangers, and they really are like family. I talk to my co-fellows probably at least once a week. We're always texting each other. If someone comes into town, it's expected that you'll probably either see them or be at their house spending the night. And then they really just push you. It's always great to have this group of people who can support you, who believe in you, who can help you envision greater futures for yourself, and really just act as a sounding board. And then from the practical skills I took from the fellowship, so I'll talk more about how I use those skills in my career now. The personal branding was invaluable for me. It really let me talk to our senior leadership about how my unique training as a clinician, plus someone with the health policy background, and as someone who was a creative and create innovative programming, how I could be a benefit to the university. So those two titles you see there is something, those are completely new positions that we've created for me after negotiations with our senior leadership. And they allow me to not only be a clinician, but they allow me to interact with the community and then create solutions that really impact the greater Jacksonville community. For example, we've created what we call our food pharmacy program. So we believe we're the first in the state that has an actual client choice kind of food pantry located in the clinic. So not only are we screening patients for food insecurity, we can actually give them the food they need. But broader than that, we also looking at and using a policy lens, we're thinking about how do we change the food environment for Jacksonville. So we've actually been working with our local convenience stores to increase our the SNAP acceptance in those convenience stores, and then also the Double Your Books program, which will allow members of the community to get double the amount of SNAP benefits for fresh fruits and vegetables. We've also created more pantries within our faith community. And then shifting to, and then also we have provided an example to others about the importance of creating a living wage. So all of our positions within my group are at $15 an hour, which is significantly higher than most of the starting positions in our hospital system. And that's all as a result of my being able to envision this, and then not only envision this, but also get the resources needed to make sure this operationalized, all came from the Commonwealth Fund Fellow. So it's coming from Dr. Reed's mentorship about how do you talk to senior leadership? How do you make the business case from that? The management classes we had at the School of Public Health, now that you have it open, how do you make sure that it's running successfully, and how are you measuring those outcomes? And this also, and larger, is just this fellowship really made me realize the importance of how you can create the vision for yourself, and that you don't have to be cookie cutter. So you don't have to be a traditional clinician. You can move around these different spaces as long as you know your true North Star, which for most of the people in this fellowship is we want to make people's lives better. We want to make sure that we're achieving equity for all.
Thank you. So thank you very much for that, Ross. Our final alumni speaker will be Alden Landry, Commonwealth Fund Class of 2010, Assistant Dean, Office of Diversity, Inclusion, and Community Partnership at Harvard Medical School, Assistant Professor in Emergency Medicine at Bethesda Deaconess Medical Center, and Associate Director of the Commonwealth Fund Fellowship in Minority Health Policy. Alden?
Thank you, Dr. Reed, for bringing me onto this panel, and shout out to Mary and Kevin for just sharing how much of this fellowship and sort of getting to know the experience is really about using the opportunity to network even before the start of the fellowship. I've had an interesting opportunity to be involved in the fellowship in two perspectives. One as a participant in the fellowship, and then on the flip side, as the deputy director and an administrator involved in the fellowship and helping to identify the next cohorts to come and participate and be involved in this experience. And for me, it's really been interesting. One, because I just want to echo everything that's been said, especially with Ross mentioning about the close-knit aspect of the fellowship and relying on each other as resources as we think about our own career advancement and addressing the health equity issues that we've identified as importance for us as the foundation of our careers. I think that it's not uncommon for me to reach out to one of my co-fellows or other fellows from prior years to ask for advice about how to address an atypical issue, to look for support and get mentorship from them. And I don't think you have many programs out there that are truly rooted in a network the way that this program is. I would say that on the flip side, I think that it's been great to see the amazing talent that is out there applying for this fellowship, because I think there's a lot of people that are coming at addressing these health equity issues from a very nuanced way that was really important for us as we move forward, trying to address many of the social ills in our country related to health disparities. And I think that the candidates that have come since I've been involved in the fellowship have really sort of taken their own personal spin on attacking some of these really complex issues. One of the things that hasn't been mentioned, and I know Mary talked about how awesome a year it is that you're in the fellowship, but I think what really happens is if you look at the fellows, the career evolution really takes place even after the fellowship, those 2 to 3 years after the fellowship, where you've gotten all this great sort of influx of information from the MPH experience, the shadowing experience, the site visits, the leadership skills development, and all of that takes time to really gel, especially for those who are younger in their academic or health professions careers. And so it may take some time, 2 or 3 years for the fellows to really solidify all of the things that they've learned to really launch forward into a mission-driven career addressing health inequities. And what you can see from some of the experiences of the fellows is they may go back to the space that they were in just prior to the fellowship, continue to work clinically, but you also see that there's a change in the content that they're producing from scholarly work, their commitments on committees and on advisory boards. And then you just see a launching, just an acceleration of their growth because they've now taken all of that learning, had some real-time application to their experiences, and just really taken that next step forward in their career and into leadership positions to help the organizations that they're a part of address health equity, really sort of challenging their boundaries of what they feel comfortable with, knowing that this is again, moving our country and our communities towards health equity. And so maybe I'll stop there because I know there's a lot of questions that are coming in, and really want to make sure we take time to tackle the questions that are coming in from those of you who are interested in our fellowship.
So thank you very much, Alden. That some of the questions that are coming in, and part of what you've heard from the fellows is around challenges, particularly as we're thinking about the pandemic now. And they have a short video that tells you about some of the work of the fellows and how they have responded. We're going to share that with you, and when we come back, we will open it up for those questions that you have.
When the pandemic hit, the Commonwealth Fund Fellowship had already been training leaders in minority health policy for more than 2 decades. By then, more than 140 fellowship alumni 100%, had been actively engaged in aspects of policy, research, and or service delivery related to minority health and or public health. And a significant number have assumed leadership roles in federal agencies, state, county, city departments, and or in national and regional organizations and associations. No one could predict that the pandemic would strike when it did, but we knew that a crisis like this would worsen disparities in our healthcare system, and the Commonwealth Fund Fellows were ready to respond. This is what we had prepared for.
What I remember from that time really is just the profound uncertainty. I remember not knowing what direction we were headed in, looking at Italy, looking at New York, wondering what was coming our way.
Having a public health lens and having an understanding of how to protect the public is very important in the delivery of care, because it allows everyone to think about all of the paths and the levers we need to pull, the paths we need to take and the levers we need to pull in order to maintain a sense of order and elevate health for everyone.
So the fellowship had a way of training me to think bigger and higher than what the issues might be happening at that moment. And so for an example, as Chief Diversity and Inclusion Officer, I was thinking through COVID and how it impacted our patients, but also how is it impacting our underrepresented in medicine faculty and trainees and students.
From the very beginning, there was a disproportionate burden of cases, hospitalizations, and death amongst Black and Indigenous people of color, and the disparities seemed to widen as time went on. The fellowship certainly provided me with a network automatically of experts as it pertains to how to address disparities in care and outcomes amongst underrepresented or minority populations. It also demonstrated to me, or helped me to better understand how we can meaningfully partner with people, whether it be folks in our community, whether it be organizational leaders from grassroots to corporate, or whether it be our civic and government officials to enact change.
And if it wasn't for the fellowship, I don't know that we would have made progress in some of the public health actions we were able to take, building epidemiological data, making sense of what was going on and helping people who were in dire need. The fellowship, is an incredible community of people that even to this day continue to do things to address the pandemic and think about how do we, recover, rebuild, have resiliency, and reimagine the future so that we're not in this position again.
I want people to stop talking about health equity just with like-minded peers in an academic space and really start to have this conversation amongst their friends, in the beauty shop or at the barbershop or at the PTA meeting and that type of thing, because that's really how we affect change. We have to talk about it with people who don't look like us. We have to talk about it outside of the healthcare space.
We're really at an inflection point. This is a window of opportunity for change. So then how do you harness that opportunity? How do you use this as a chance to finally address structural racism, achieve health equity in a sustainable way? And I would say, what could possibly be more important right now?
Even though we're trying to address the issues related to COVID-19 and the pandemic, the other healthcare inequities that were present before the pandemic are existing through the pandemic and will last beyond the pandemic. So I think that our fellows are uniquely positioned because we've been thinking about health equity and health policy for years, and now we can apply our lessons learned through the lens of a pandemic, focusing in on addressing those health inequities that other leaders may not be thinking about because they may have other areas that they're trying to focus in on. And I think there are opportunities for the fellows to step in and to lead in the spaces where leadership is lacked. And I think that's one of the fundamental strengths of the fellowship is people are given the tools for success.
So thank you. And thank you also to all the fellows and what they've done during this time. I want to turn now to questions and answers. I'm going to ask for the fellows to unmute for part of this so that you can step in to answer just some real quick clarifying points. I saw that in the Q&A, there was a question about, could you go for an MPA or were there prior requirements? The only individuals who can, the fellowship will support for an MPA are individuals who have already earned an MPH. So that that's a requirement for the MPA and the fellowship. There's also questions about, do you need to be here? It's not a part-time program in the sense of like an executive program, that you really need to be here. And part of what you heard consistently across the board is the fellowship of the fellows, and they're coming together. And what happens with that? And that doesn't happen if you meet, a couple of weeks every few months or something. It's really how they come together and work together. So I would say the vast majority of the fellows have resided in Boston. Some have brought their families. Some have had their families that have stayed wherever they're coming from, but and find ways to commute and go back and forth. But the fellowship is a on-site program here in the Boston, Cambridge area. And I'm going to turn some of these other questions over because I think it's best answered by some of the fellows. They're asking about whether or not you can keep clinical duties during the fellowship year. And I actually turned this over to them. They can tell you what they've done or what they think is feasible. Why don't we start? Alden, why don't you speak to it? And then Kevin, why don't you speak to it? Because yours has been a slightly different way that you're doing it. Alden?
Sure. I'll keep my comments brief because I also want to make sure Mary has a chance to speak on this because I know she and I had different approaches to the fellowship. So I think for me, I came to the fellowship fresh out of residency. I'm an emergency medicine physician, and I was worried about sort of that growth that happens from the transition from resident to attending and potentially losing my clinical skills. And I can say that I did work part-time clinically while doing the fellowship. I could say that I also, in retrospect, think that I wish I would have maybe worked a little bit less than I did, even at a part-time level, mostly because I think that the experience of the fellowship is really where my career is more anchored at currently. And I probably would have gotten to taken advantage more of the conversation that we're having earlier with the networking if I had less clinical responsibilities. That being said, I think it is doable. I think you have to have an understanding of what your relationship is with the institution that you're going to be working at clinically. I think you're going to have to make sure that you find balance, understanding that the fellowship activities will take up a large portion of your time, especially during your education, during that summer months where you're getting your a core chunk of credits taken care of during the summer. And then I also think you need to make sure you aren't missing fellowship related experiences because you're taking on academic or you're taking on clinical experiences, because you're going to miss out on some really great opportunities there. And so really, when you come into this year, your focus needs to be on what is the fellowship going to offer me, understanding that clinical medicine is not going anywhere, and you will have those opportunities to re-engage at a later time and a later date.
Mary or Kevin?
I can go next. I did absolutely nothing clinical in my year, and it was wonderful. And so I think I was a little nervous to Alden's point about losing some of my skills, especially as a surgical subspecialist. You worry about, not having your hands busy and whether or not your skills are going to fall off. But I think it was great to be fully immersed in the fellowship, not have any distractions. I didn't feel any worse for the wear when I finished. I did actually look forward to going back to practice clinically because I knew I wanted to be board certified, and that required clinical practice. And what it motivated me to do was to find a position where I was going to be very well supported clinically when I finished. And so I entered an employee practice that was well established, very busy, with a lot of support, and I didn't have any problems retransitioning into clinical medicine. And so I, stayed on for a few years and was boarded, and then decided to meander about. That's a different story.
Yeah. So Dean Reed mentioned subtly different trajectory for myself. So I knew coming to Boston that I want to apply for the fellowship. It happened to be along the way that I started to get engaged in some research, and there were people who were motivating me to apply for something called a K Award. And so I said, well, I will apply for the K Award, and in the K Award, you have to describe your educational trajectory. And I infused the Commonwealth into the K Awards. I would not advise anybody to try to do these two things separately. But fortunately, I was supported by the K. I did get into the Commonwealth, but my K protects 75% of my time. And so I have time and space to attend class, to go to galas, to do the receptions, to have weekly meetings with Dean Reed. So I'm really not in clinic because the research time, protected time, I get to be doing the fellowship. And you're a full-time student. That's what you're supposed to be. You're supposed to be a full-time student in the MPH program. So you really don't have actually space and time to do other stuff. Perhaps you could, moonlight on the weekend, but you can't see patients during the week. It'd be really hard, I would say that much.
Thank you for that. One of the questions was about, can you keep a university appointment? Many of the people who come to the program keep their university appointment or wherever they were working before they came to the fellowship. Many, as they transition to the fellowship, decide they don't want to go back. Some want to go back, but they want to go back in a different way, in an expanded way, and to utilize the skills that they've been developed and the network that's been developed over time. So it's a mixture. One of the things you're going to see across there is not a one example of this is what all fellows look like, or this is the path that all fellows follow. Each one is unique. Each one has their own personal journey. Each one has what they want to accomplish and where they want to go next. So there was a question also around private practice. Somebody's been in private practice. When we are looking for people who have leadership potential and have been involved in leadership efforts and are deeply committed to issues around equity and eliminating disparities. And it's not a look of, does somebody come from an academic sector or government sector or private practice? We've had individuals from all of these places as participants in the fellowship. So it's not this unified background that they've all had. There's a
Joan, just to add to that, I think one of the great things about the cohorts of the fellowship is the variety of the individuals that come to the fellowship. And as you can see from this current cohort of fellows, it's not one particular medical specialty that's coming. And if you also look at the fellowship, it's people coming at various stages of their career. Some are more senior, some are more junior, fresh out of residency. And I think that also adds to the richness of the fellowship, because I think we all bring our own lived experiences, our educational backgrounds to this program. And so when we're having those conversations, it's people who have been in private practice. We've had someone who was in the military for a long period of time and joined into an academic practice and then came into the fellowship. We've had people who felt that they were towards the end of their practicing career and wanted to make that transition towards a space in policy and advocacy. And so this was the opportunity for them to make that change in trajectory for their career. So I don't think this is something that you should be thinking about of, am I too old for this or am I too young for this? I think it needs to be, is this the right time for me to think about me making a change in the trajectory of my career towards policy and advocacy in addressing health inequities.
Thank you, Alden. There's also questions about practicum and how does that work and what you did. And I'm going to ask Ross, maybe if you can talk about the practicum and maybe if someone else could also fill in terms of practicum.
Sure. So the Practicum experience was really great. Kind of ties in all the lessons you learn from the fellowship. My practicum was actually in the FQHC world. That's an area I really didn't know much about. So I wanted to really explore that. And then I also had an interest in technology. So I tried to use my practicum to bridge those two. So I helped the local healthcare system in Boston create a monitoring system for health disparities using their EMR. But the practicum experience was great. I know in my year, I can remember we've had people who did human trafficking work. We had some who did the integration of oral health and primary care. We had people who looked at workforce development with community health workers. So the practicum is really great. And I think that it really gives you kind of a body of work to take to your employer, say, this is what I've done in this year when I didn't have the full time to develop to it. But it still was a great experience, and it expands your network too.
Maybe, thank you for that, Ross. Maybe someone else can also speak to the issue of, the question was like, do we hand you the practicum or are they yours?
I can talk about my experience. So, you're instrumental in creating your own practicum project. And so thinking about your interests, where you want to go, what you might want to learn more about, where you want to make connections. And then, of course, there's help along the way in guidance and facilitation, but you're responsible for creating and finding your own practicum project. I did mine with the Boston Public School System. So I'm a person who likes, interdisciplinary things. And that was really exciting to work with the school system around their reproductive. They were creating a health education curriculum, but I worked to make sure that the reproductive health portion was age appropriate and comprehensive across age ranges. So it was a really nice way to fuse my clinical knowledge with something that can impact generations.
Another part of this is asking a little bit about class size, but also about what has happened during the pandemic or what's going on. And our current fellow on this call is Kevin, and maybe you can talk a little bit about what this has been like for you and what's the experience of current fellows.
Yeah, so I was answering the question. So there's, I think between 6 fellows. You can go onto the Commonwealth site to look at the various classes, but with respect to COVID and this year, so again, full-time students, that means that some classes are in person. So our US health policy taught by a former congressperson was in person. That class would have some kind of guest speakers that were virtual. Our economic analysis class is in person. There are some asynchronous courses that you can do on your own time, but the vast majority of the classes were in person. And then beginning in the summertime, you're a part of not just like the Commonwealth, but there are other fellowships going on in the School of Public Health. So there's a large cohort that take like biostatistics, 1 and 2, epidemiology. And so that course was done via Zoom because legitimately people were China, Italy, as well as the United States. So, Zoom afforded people that were international to participate. But the hybrid model has been pretty good. And then we have face-to-face meetings with each other. Our writing workshop that we have on Friday is in person. So to me, it feels very natural in terms of attending classes in person or virtual.
Kevin, some of the questions within that is how do you relate as a group? People are talking about their cohort and making connections. Has that impacted your ability to?
Oh, yeah. I can't stand my group. No, I'm joking. So we're all friends. So we eat out together. We get lunch together. My daughter that you saw, she turned 3 in September. So Shalawa, one of the current fellows, brought her son, who's also an infant, who is an infant, to the baby party. One of the current fellows' husband is in addition to being a physician, is like a stand-up comedian. He's performed in Boston. We went and supported. So it's a collegial group. We all have the this is the nice thing I think about we have the same focus of what we want to achieve in terms of health equity. And so, you know, in residency or in fellowship, you might be the person who wants to do that, but here now you're with a group, and then this large network that exists, it's just like renewing week after week after week.
Well, thank you for that. Somebody has asked about the difference. If somebody already has an MPH, what will their coursework look like if they're going for an MPA? It would be the coursework for the Kennedy School of Government. You would not repeat those same classes. So you've had biostatistics, you've had those courses. You would not be repeating them. You would be taking new courses. You would be integrated with other students at the Kennedy School, but also spend a vast majority of your time also with the fellows. It's networking two systems and across those two systems, navigating across two systems. But it clearly can be done, and individuals have done that and done that well. I'm trying to look and make sure that we're getting to all of the questions that are here. Some of the questions are about individuals. It's not just, can I keep my position where I was or practice clinically? They're asking about, can you make it? When you go from, particularly from a larger salary, going from a residency is not such a big salary, but when you've been out practicing and you come back to the fellowship, this is a stipend of $60,000, but maybe some of you can speak to how people are able to make it during this 1 year.
Sure. I would say that, you know, coming from an attending salary to the stipend was a shock. When you look at that, and Boston rent is a lot more expensive than Florida rent. So what I would suggest is definitely look into Harvard housing. It's the most affordable and it's the nicest, and it cuts out all of that going through the brokers. And it's generally just an easier process to do. So I think the housing piece is the biggest part to figure out in Boston. The rest of it, usually, I mean, they feed you well in the Commonwealth Fund. We were going to dinner all the time. I don't know how it is currently, but you always had a meeting, you always had a reception, you always had something. So that part was kind of taken care of. It was just really make sure you had your dry cleaning, because there's always a suit or blazer ready to go, because you never know when you had a meeting, but it's doable. It's just, and you're in class most of the time, most of your day anyway. So you don't have all this free time to be spending money, but it's definitely a shock. You just pay attention to your budget.
Anybody else want to speak to that?
I think that about something. Boston is expensive, but I was coming from residency, so it was kind of a lateral move except for the increased rent. I lived in Roxbury and loved it. I took the train everywhere. I enjoyed public transportation, so that decreased costs. And like I said, we did eat well. My waistline felt that too at the end of the year. But it's, I mean, you just as a plan. I mean, it might not be something you do next year. You might want to save a couple of years and apply in 2 or 3 years when you can supplement your salary if you're or your stipend if you're used to a grander lifestyle.
Yeah, I was gonna say current. Some of the current fellows, some are, you know, from medical directorship positions, and you know, live in the student housing. Someone transitioned from New York, and when they're here, they're actually kind of subletting from their friend who happens to also be a physician here. So, you know, it depends on, you know, tap the network that you might already have. But the student housing is affordable. And then, yeah, not until Ross actually just mentioned it, I was like, I actually technically have never paid for a meal since being here, because yes, they're always accommodating.
So I want to thank you. Thank you all. Thank you for the wonderful questions. Thank you for joining us. I want to thank Dr. Simon, Dr. Fleming, Dr. Jones, and Dr. Landry for being with us today. Dr. Zephyrin and the Commonwealth Fund for these years of support and ongoing commitment to addressing issues of equity, of moving us much more towards elimination of disparities. Thank you to all for being with us today. As said before, this webinar will be posted so you can return to it. You also have contact information so that you can ask us any questions. Please visit the website. You can hear more about the fellows that you see here, but also learn about other alumni fellows. You can also learn about them through the Reed Scholars, which also has a website. Thank you for being here. At the end of this program, there is a poll. I ask that you stay on long enough, please, to answer the questions from this poll. We find it very helpful. Again, thank you for being here with us today, and be safe.